Validate their feelings. Validate their experience. Validate their value. Allow them to be sad. Don't say, I understand, when you don't. If you haven't experienced it, no, you don't understand. And you're actually discounting their pain when you say that. It's okay for them to be sad. Let them go through the valley of the shadow of death without trying to find them an off-ramp. That's counterintuitive, isn't it? We want to help. We naturally want to try to pull someone out of the valley of the shadow of death. But don't do that, because you can't. Instead, walk with them through it. Walk with them through it. That's what Jesus does, and so should we. Okay then, how do you do that? What do you say to validate someone's pain?
A lot of times people who are struggling with mental health issues in particular, but also with grief and other things, can just feel like a burden. And so specifically saying things like, I'm so grateful that you shared this with me. Thank you for opening up and telling me this. I know that it must have been really hard, and it probably took a ton of courage for you to share this thing with me. You have nothing to be ashamed of. It's not your fault. You're not a bad Christian. There's help available. You're not alone. Can I come hang out with you? Do you want to come to a movie with me? How are you doing today? Do you want to talk? I'm proud of you for continuing to fight. It must be really tough, but you're doing a good job. And then just, the basics about asking if they're getting help. Hey, have you talked to a doctor? Have you talked to a psychiatrist or a counselor or a therapist about it? Can I go with you to your appointment? Can I help you set one up? Anything that makes the person feel like they're not alone and that they have support in getting help is going to be huge.
5. This one's for churches. Have a resource list.
I believe it's crucial that every church have a list of resources available for people in your congregation who are in need. So those resources should include any low-cost or sliding scale clinics that are available. If you have people in your congregation who don't have insurance, but they need antidepressants or anti-anxiety meds, then you're going to want to know where you can send them, that they can see a doctor for a reasonable cost. You're going to want to know about any good counselors and therapists that also take a sliding scale, which there will usually be quite a few in any given area that will work with clients and what they're able to pay. And then I would suggest having a list of multiple different therapists and types of specialists to help with the different kinds of mental health issues that your congregants may experience. So you'll want to have at least 1 or 2 great marriage and family therapists who can help your congregants who are really struggling in their marriage. You want to have somebody who's a trauma specialist who can work with people who've been abused, if somebody's been sexually assaulted or raped, even if you have veterans who've experienced PTSD from combat or any type of trauma. You want someone who's specifically trained to work with that because of the ways it changes the brain and the body. Grief counselors and youth and young adult counselors, people who do therapy with children. Those are all some different kinds of options you should have available. Ideally, you want to get recommendations from people you know and trust who've had very good experiences with these professionals, because you may find on a website that someone's a Christian counselor, but then they may not be a very good fit for a lot of people. Or anybody can call themselves a biblical counselor, but that doesn't mean that they're actually trained and licensed in therapy and therapeutic interventions. So those are just some specific tips that you can use to help find some really great resources for your congregants. And then also that helps take some pressure off of you. You don't have to commit to these long periods of counseling congregants in things that you maybe just feel out of your depth in. So yeah, it's really important to just have partners in the community and resources to be able to refer your congregants to.
We can make every church a safe place for people to admit they struggle with depression if we, as the people of God, take these 5 actions. 1, don't have all the answers. 2, don't blame them. 3, be there for them. 4, validate their pain. And 5, churches, have a resource list. Can church be a safe place for people struggling with depression? For the sake of the lost and dying world we live in, it has to be. And I know it can be. So let's use what we've learned in this video to make it that way. We can do this. We can be Jesus' heart to the hurting, offering hope and healing without condemnation, just like he does. Thanks for watching.